Hello, everyone, and welcome to today's webinar session, first in our How-To series called How to Be a Great Mentor, featuring St. Joseph's College alumni and healthcare professional Megan Haughton. Before we start, please make sure that you can see and hear us clearly on your computer, phone, or tablet. You can open the chat box by clicking on the chat icon. To hear audio for the webinar, click on the phone icon. This is only if you haven't already dialed in via the email instructions that we've given you. I'm Dee Kaler. I'm the Associate Director of Alumni Engagement here at St. Joseph's College Brooklyn campus, and I'll be your host for this session. Just a little housekeeping before we get started. Please note that a recorded version of this webinar will be available on our website. We'll also be sharing the presentation slides with all the participants who are interested in receiving them. You will receive a survey at the end of this webinar session. If you
know the webinar's on, right?
Yeah.
You know the webinar's on, right?
If you have any questions, please hold on to them. We'll be addressing them at the end. Make sure to open the chat box by clicking on the chat icon and typing your questions into the chat box. Throughout this session, we'd also love to hear from you on social media, so please feel free to connect and chat with us through Twitter and Facebook as well. Our handle is @SJCNY I now would like to introduce our presenter. Megan Haughton is a registered professional nurse with over 18 years of nursing experience. She works at Kingsbrook Jewish Medical Center in Brooklyn. She holds a bachelor's in nursing from St. Joseph's College and a certification as a licensed practical nurse from Bronx Community College. She has a master's in healthcare administration and a master's in nursing administration from Central Michigan University and Columbia University, respectively. For the past 9 years, she's been working in the Department of Case Management at Kingsbrook Medical Center and has been instrumental in the development of the Emergency Department Case Management. Megan is involved in a number of professional organizations, including Case Management Society of America, Association of Clinical Documentation Specialists, and the American Organization of Nurse Executives. She's actively involved in the mentoring of nurses, students, healthcare professionals with their career growth. She's also an active mentor as part of St. Joseph's College's professional mentoring program, SJC Mentor. So now, without further ado, I'll turn the time over to Megan.
Thank you, Dee Keller, for your invitation to speak on a topic that is so dear to my heart and one that I so warmly embrace. Thanks to the St. Joseph College Alumni Association for introducing the webinar to the student body, an important learning tool. Also, a big thank you to my online and phone audience. I know each and every one of you can relate to my topic, how to be a great mentor. I promise to make this event an enjoyable yet educational one. I'm going to share with you some very important ideas that I have discovered during this mentorship journey. It is truly an honor to be presenting today. First, let's review our objectives. I will be defining mentoring, also discussing the different types of mentoring, explain the mentoring process, review the types of mentoring relationships, discuss mentoring skills to build relationships, and finally, go over the mentoring evaluation. If we look at the dictionary, we see multiple definitions of mentoring, but the one that I'm going to use is the one that's defined as a collaborative learning relationship. It is a structured process for supporting professional learners. It's a dynamic process that provides guidance and counseling. Mentoring is a powerful way to make an impact on the future of another person. It is a relationship that meets a need while helping with the development of another to reach his or her fullest potential. Many organizations are now using mentors to foster relationships to help with career development. Also, if we look at the research, we'll see that it shows that mentoring culture is a clear expression of an organization's vitality. A mentoring culture helps people to adapt to challenges. The learning gained through mentoring may affect those outside of the mentoring relationship as well. It builds new relationships and it strengthens existing ones. Mentoring does make a big difference, and it's used now. Students are using it. Practitioners from all walks of life are using it to provide advice and guidance. The purpose of mentoring is to establish and formalize a relationship, and that relationship is between a mentor and a mentee. There are different types of mentoring programs available. We each must choose the one that will work for us. So we're going to review the different types of mentoring. We're going to look at traditional mentoring, group mentoring, team mentoring, peer mentoring, leadership mentoring, as well as virtual mentoring. Traditional mentoring is also called one-on-one mentoring. It's viewed as a long-term face-to-face relationship that fosters the mentee's professional, academic, as well as your personal development. Many colleges and universities are using this. This is where one mentor is matched with one mentee, and this is over a course of 9 to 12 months. The time period may be extended depending on the learning needs. Two people are paired based on certain criteria, such as their experiences, their skill sets, goals, and a variety of other factors. Let's review some of the pros of the traditional mentoring. It helps with the development of personal relationship because over a period of time, it's a one-to-one interaction, so there's no fear there. The con is the availability of the two persons, the mentor and the mentee, and that can create limitation in the relationship. Now we're going to look at group mentoring. Group mentoring uses the ratio of one mentor to 4 mentees. Examples of group mentoring are adult to youth mentoring. Group mentoring is defined as a set system for an individual development that utilizes multiple experts, and the experts, of course, are the mentors, and multiple learners who are the mentees in a group setting. Although in a group structure, learning is still individualized, and each mentee works on his or her learning needs and goals. Pros of the group mentoring: it provides for greater exposure to multiple levels of expertise and knowledge, as each participant brings their own competencies to the group. Also, the group brings in a diversity of perspectives to different issues. Example: one person presents a situation, and others in the group are asked for similar situation and resolution. In a group setting, you're going to have multiple ways of resolving the same situation. Some of the cons of group mentoring: each member has different needs, and that need must be balanced with the group needs. The group mentoring does not offer the personal relationship that is linked to the one-to-one or the traditional mentoring. The relationship formed between and among mentors and mentees goes beyond that of a teacher-student relationship. So group mentoring is not the teacher-student mentoring. Group mentors guide rather than train. The group is safe and it's confidential, so the group members are able to explore and share safely. Let's review team mentoring. This is where you have several adults working with small groups. Each mentee will have several experienced, well-established members of their profession providing mentoring. Team mentoring requires team effort. One mentor may work with the mentee on a specific competency area, while another mentor may be working with, say for example, networking or perhaps career development. In team mentoring, the mentee learns to use the mentor, very important, as a resource. How to make team mentoring effective? You have to determine your goals. Define what it is you want to accomplish. You have to choose the right people. It's best to capitalize on the knowledge and experience that exists within that team. And very importantly, you have to develop an action plan. We'll talk some more about the action plan when we get to that slide. Now we're going to look at peer mentoring. Peer mentoring is a mentorship that takes place between a person who has lived through a specific experience, and that is the peer mentor, and a person who is new to that experience. An example of this is a graduate and the student, and it can be used in any setting. It can also be used in the workplace setting. For example, the new nurse and the more experienced nurse, the new teacher and the more experienced teacher. How this works in the academic setting. It works to help your mentee to find information about academic resources, such as your academic supports, the availability of them, student organization, etc. You have to work to accomplish specific goals, example, tutoring, assistance, referral, peer advising with time management. In peer mentoring, it's the person one-on-one, it's the interaction that you have that is important. Peer mentors are very important to know. They're not your parents. They're not your therapists. They're not your solution to all your problems. They're there to teach, inspire, motivate, and empower you. Now we're going to review leadership mentoring. This is where a senior level leaders, usually someone from director level or manager's level and above, mentor someone at a lower level as a part of strategic planning process to create a blueprint for the future. And all organizations have to do strategic planning. Not only is the organization creating a succession plan, but they're also helping to create exceptional leaders that are planning to stay with the organization. Now we're going to review virtual mentoring, and just like it says, it's mentoring. Any mentoring that doesn't take place face-to-face is considered virtual mentoring. One of the benefits of virtual mentoring is that it provides access at any time and anywhere. People in remote settings or usually, this is more beneficial for people who are in remote settings. With technology, virtual mentoring is something that we will want to use and access to reach a bigger audience. Let's look at the mentoring process. A mentor and a mentee, they have to start a relationship. In starting the relationship, this is two strangers getting together. They must start to get to know each other. They have to decide on their time management, their meeting schedule, their goals, objectives, obstacles, and successes. They have to be open to feedback, and very important, they have to know to build trust and confidence for the relationship to work. Characteristic of a successful mentor. That mentor must be able to motivate the mentee. That is, help to create and sustain a learning experience. The mentor must be able to inspire and coach. What do we mean by this? Should be able to build self-confidence and self-esteem with that person you're coaching. Very important, you have to lead by example. You have to be responsible. You have to be respectful, and you have to be ready. If you have a pre-decided time, you have to stick with the time. You have to be open, non-judgmental, reliable, a good listener. You must listen for facts, not for rebuttals, because if you listen for rebuttals, you're going to lose a lot in the message. You must be caring, have a desire to engage regardless of your interest in the topic. You must have a lifelong commitment to learning and dedicate to the success of others. The overarching guiding principle for the mentor is to facilitate success of your mentee. Mentoring skills to build relationship. You must be an active listener. Be mentally and physically prepared to listen. You must be present. You cannot fake attentiveness. You must be that role model who is a compassionate human being. And very important, you have to give your mentee opportunities to participate. And you have to set achievable yet realistic goals. Let's review some of the benefits of mentoring. As I earlier said, a lot of organization is reviewing this as a tool and a skill set to build on their organizational skills because it helps with professional development. It helps to develop new or different perspectives. So not only is the mentor learning, but the mentee is also learning from this relationship. It helps you to build and develop career opportunities, networking, and it complements your formal learning. The reality is that mentoring is a relationship where both the mentor and the mentee learn from each other. It helps with your leadership and management development as well. Because you're learning from a more experienced person, you're able to transfer that knowledge from the classroom to the career setting. Let's review some of the bad mentoring relationships because, of course, that is going to happen. And some of the times when the relationship goes bad, sometimes it has nothing with the individual, but sometimes it does, such as crossing of boundaries, asking too much personal information, lack of interest. The mentor and the mentee must be engaged. If one person is lacking interest, you have to bring the person back or you have to close the relationship. Boundary can be, in the beginning of a relationship, you want to develop what you need to speak about. If your mentee wants to speak about a certain area, you allow that person as long as it's keeping with the guideline of the goal that you formulate. When you have a bad mentoring relationship, you want to review the mentoring agreement. Some of the things that you want to ask yourself is, was it realistic? If it was not, why not? You want to review your learning goals. Were your goals realistic? You must be open and transparent with each other. And very importantly, if the relationship is not working out, you must end it in a positive yet professional way. Some of the guide for the mentor and the mentee. In the beginning, you have to define the relationship. You must make clear roles and expectations. What each of you want to gain from that relationship. You have to develop or recommend topics to cover at each meeting. You can't just show up at the meeting. You must have something to discuss. Very important that you have to have time commitment for each other. Remember, we have to respect each other's time. So if the time is 1 o'clock, we must be there at 1 o'clock. You have to explain the importance of commitment to the relationship for the mentor and the mentee. And developing an action plan is where it serves as the guide for the relationship. While you're going through the relationship, you have to do some reflections that are important to the relationship. You have to ask yourself, do I feel comfortable asking for advice? Do I want to share everything with my mentor versus a selective discussion? How much time can I spend with my mentor each week or each month? It's very important to have that mapped out at the beginning of the relationship. Now, let's look at the mentoring action plan. It's called a map, and it helps you to bridge between where the mentee is and where that mentee wants to be. The map is an effective mentoring process, and it begins by outlining your objectives. And some of your objectives are your purpose, your intent, your goals. What do you plan to accomplish? Assess in the early phase of the relationship for existing knowledge. Also important, you must determine the best method of learning, whether that person is a visual learner, where their preference is for images, picture, auditory, where their preference is for sound and music, a verbal, where it's in speech and writing, or physical for most nurses, where their preference is for touching and doing things. And of course, most of my nursing colleagues are now raising their hand and going, yeah, I'm into physical learning. But all of us can say some part of the learning method, we can participate in it, but we're mostly leaning to one area, and which is our more dominant method of learning. In the planning phase, you want to ask yourself, what skills do you want to develop? How will you know when you have successfully developed this skill? And how will you apply your new skills professionally? So let's look at the mentoring action plan. And the action plan actually helps you to create benchmark to check your progress. Ensure it's realistic to attain the goal within the given time frame. You must have a due date and a check-in date to measure progress. So of course, you engage in weekly, whether it's weekly or monthly mentoring sessions. And is it via communication? What's the beginning date, the end date? What are the goals that you have? Were those goals accomplished, or are you continuing to work on those goals? And at the end of the program, you want to review, and more importantly, you have to share your knowledge. So in your first meeting, mentor-mentee, you introduce yourself with confidence and a smile. Talk about yourself and ask questions about your mentee. Clarify roles and agree on boundaries. Remain positive and end on a good note. And that, of course, is the building phase of the mentoring relationship. In your follow-up meeting, you will want to enhance that relationship. How are you going to enhance this relationship? You have to set goals. Your goals can be career-oriented or an academic focus or anything else that your mentee wants to talk about. Later on in the relationship, you have to continue to sustain it. Here is where you may have some struggles to live up to the expectation at the start of the relationship, such as your weekly or your monthly follow-up may not go as you had planned. If this happens, don't panic. Just review the goals that you have previously set. Finally, you're in the transitioning phase, and it gives you and your mentee some closure. Now we're going to review the mentoring evaluation. I'm going to be reviewing the one specifically designed from St. Joseph College. They have two evaluations, one is for the mentor and one is for the mentee. And in the evaluation, they ask the mentor and the mentee a set of questions. And this serves as a guide to further develop the mentor and the mentee and also to successfully develop the program. One of the questions asked is, were you able to receive from the mentee? The question asked was for the mentee. Were you able to receive the support you needed from your mentor? Now the question is, how do you think your mentor influenced your life? What are the goals you agreed on at the onset of the relationship? Very important, you have to have an evaluation throughout the program because you need to know where you start and where you are in the process. For the mentor is, did you find your interaction with your mentee constructive? Did you experience any difficulties or challenges in your relationship? Of course, with every mentor and mentee, time management is usually one of the biggest struggles. An evaluation must be conducted throughout the program. It should be done for both the mentor and the mentee. Question that should be included, apart from those that St. Joseph have, was, were the goals met? If not, why? Were they realistic? Do we need to reset goals? Do we need to make the goals more realistic now that we're in the relationship and know what we are to expect from the relationship? The question is not only who can be your mentor, but also who can you mentor? Bo Sanchez says, getting a mentor is the shortcut to success. I end with this thought. Mentoring cultivates positive relationship on both sides. Do it. Get involved because it's the right thing to do. The vision is to have a positive influence while formulating a relationship. And yes, continue to pass the torch along in the mentoring relationship. And now pass it on to Dee.
Thank you so much, Megan, for this insightful presentation. This is a live event, so you have a chance to pose questions. You can submit your questions in writing via the chat feature. I'll go ahead and ask the first question. In the presentation at the onset, you mentioned team mentoring and group mentoring. What's the difference between the two?
So there is a difference between team mentoring and group mentoring. Group versus team. A number of individuals forming a unit to coordinate their individual efforts, while a team is a group of people who share a common goal. So in that group, you can have people from all walks of life. Like the example I gave was the adult to youth mentoring. So they're from all different walks of life. While a team, they usually share the same goal, whether this goal is it's nursing, it's teaching, educational, academic, whatever the goal and the purpose is, it's the same.
Okay. And also, we talked a lot about, the mentoring action plan. In your own personal experience with your mentors, do you encourage your mentees to keep a learning journal or a development plan that they can sort of check back on a frequent basis, or how do you hold them accountable for some of the goals that you've clarified at the beginning, and how do you track that progress?
Our progress is tracked with our weekly, or our plan initially was to speak or at least meet weekly. But with mentoring, like I said, time management continues to be a struggle. I do track the mentoring goals. The goal is the person that I'm mentoring, and at any given time, I'm usually mentoring 3 to 4 persons. I do mentoring with St. Joseph College. I do mentoring at my job, and I also do mentoring with my new staff. Mentoring, the difference is once that person is off orientation at my job, I go through the mentoring process with them. The reason is I need them to thrive, not just to survive. And every new learning area, people will get panic. So they need to know that someone is out there for them. Usually I develop that action plan and we go over that tool weekly, and by that tool, we said whether or not you had accomplished this goal, what do we need to improve, how can I help you to accomplish the goal? Is the goal that I set previously unrealistic, or you set unrealistic, or together we set was unrealistic? How do we change this goal? How do we redefine this goal? How do we make this goal work? In the workplace setting, if the goal that we previously set was too high or too challenging, what I will do is I will step back from that, reevaluate how I set that, reevaluate my teaching mode, reevaluate my coaching mode, because my intent is to inspire that person. My intent is to make that person the best person he or she is.
Thank you. One of our incoming questions asks, when did you start your mentoring journey? And can you speak about who influences your journey?
My mentoring journey started the day I came out of nursing school, and it's a personal journey. And when I went to the unit, I knew I was not going to survive. In nursing school, you're given 1 to 2 patients. When you hit that unit to work, off orientation, you're given 7, upwards of 10 patients. Some critical. You may have 2 critical patients at the same time. And I remembered meeting 2 people during my journey, and that's Janice Leacock and Michelle Baker. They were very influential in my journey, in my career journey. They helped me to grow. They helped me to define myself. They helped me to learn. They helped me to keep steady and watch the goal. And also, what I learned from the relationship I had with them is how to mentor someone else successfully. Because if I didn't have them, and though at the beginning of my work relationship, we didn't have a formal mentoring process at the job. Now we do. I knew I need mentoring. I knew if I did not have mentor, I will fail. So when I gravitated to them and would ask them, how do I do this? And I would continue to go to them. Which is not orientation. It's different from orientation. It's like constantly I need the guidance from them. Constantly I need to be coached by them. Constantly I need the pathway for them to constantly tell me, you're doing the right thing, this is the way you go. So even though this was in an informal setting, it still benefit me to this day. And to this day, we have that formal name to it. I can still say that because of that relationship, it inspired me to inspire others and to mentor others. So I always continue to do mentoring. I do it at my job. I'm willing to do it. I have people knock on my door. Can you be my mentor? And I will always say yes. But however, as a leader, I don't have the time I had before. So what I will do is my mentoring now consists mostly of not so much face-to-face, but a lot of it is virtual. Meet once in a while, a lot of it is virtual. Now, if we don't and we're not getting and sustaining the same goals and we're not coming at the same end point, then this is where we need to meet face-to-face and redevelop ourselves and look at whatever we had started before and see what we need to change.
That's very helpful. Thank you. Another of our guests asks, you've talked about different mentorship types. Is the use of one mentorship type over the other depend on the desired outcome, or are certain types of mentoring better than others?
It depends on the individual and what the individual wants to accomplish. The traditional one is, or the one most people are known to use, is the traditional one-to-one mentoring. But it depends. Like in the group setting with youth, I do believe that would better them. It will have a better outcome if they use the group setting for the youth, because all are coming with a common goal, or they're looking at a big brother and they're trying to accomplish something. For the team setting, you have different types of leaders at different areas in their professional development, so you can learn something different from them. The one-to-one mentoring, it provides you with that one person all the time. And, some people prefer that relationship because a lot of people are not open to communicate. They like the confidentiality of that one person. So it depends on what you want to accomplish. Each of that mentoring style will work for you. So whatever you want to accomplish, you got to choose your style. That's why I presented all the different styles.
Thank you. We talked about this briefly prior to the webinar session, but do you have any advice for mentees in the way of communicating with their mentors? From our personal experience from the SJC Mentor Program, our mentees need guidance on how to professionally conduct correspondence and interaction with their mentors. Do you have any advice for them?
The advice I have for the St. Joseph College, and I think this works for just about everyone who's entering or listening and planning to enter into the relationship, you must be prepared. You must be available. You must listen. And like I discussed before, you can't listen for rebuttal. You must listen because you want to learn. You must be honest. You must be open to communication. And if you don't listen, then the relationship is not, you're not ready for that relationship. You must come with a goal. You can't turn up and you don't have a goal. You can work on the same goal from beginning to end. The goal just needs to change over time, depending on where you are in your career, your academic setting. But communication, time management is a problem, and it has to do with the individual. It has nothing to do with the mentor-mentee relationship. Is more of the individual.
Okay. And sometimes the mentor and the mentee are not a good fit because of personality reasons. In such cases, would you recommend perhaps doing like a chemistry call prior to formalizing that match, for them to come together and see if that synergy actually exists?
It is good. The chemistry call is good, but from the first onset of the relationship, you don't really learn that much from the mentee. Throughout your discussion is when you start learning about that person, and then that is when you start saying or realizing that it's not a good match. And it could be the infrequency of the calls. It could be that the person doesn't have any goals or they're not sure of their goals. As the mentor, you can provide guidance with them about where to go if there's no goals to develop, or you can help them to develop those goals. But if ongoing the relationship just is not a good fit, it's time to end the relationship. As previously discussed, you must end it in a positive yet professional way.
And is there an ideal duration of mentorship? I know in a traditional mentoring you mentioned the 9 months to 12 month period.
The research shows that 9 to 12 months, but a lot of mentoring relationship goes on forever. Some research define it as a long-term relationship without a duration. Some defines it as 9 to 12 months. It depends on what you want to learn. If learning was not achieved, I don't think because of the 9 to 12 months that was defined that you should just break the relationship. You can extend the relationship until you achieve your goals.
Okay. Another guest asks, when do you think when do you know when is the right time to stop mentoring a person?
When all the goals are achieved and there's no new goals to develop, that's the time to end the relationship. Again, though, if that person wants to sustain the relationship, I do believe you can sustain it. It might not be in a mentoring role anymore. It might be more as a guide. When that person needs you, that person reach out to you.
Okay. Okay. Is there anything else that you want to cover, Megan, before we wrap up? Any last thoughts?
Last thoughts with it is if you can become a mentor to someone, please do. We have enough people out there that needs guidance. As I spoke to you about before regarding my career development, that I went out and I seek someone to guide me. I need each and every one of us. If you cannot be a mentor, then more importantly, become a mentee. And if you can't be a mentee, become a mentor. There are a lot of programs out there. We started the St. Joseph College mentoring program. A lot of colleges now are starting it because they're finding that it is actually helping students. It's helping them with academic success. It's helping them to create a pathway to learning, because now people are seeing that the challenges that they think that they are so isolated in forming, or they're isolated in that challenges and they're the only one going through it, you will find that other people have gone through it or other people are going through it. So it's very important. Either you become a mentor or you become a mentee.
Okay, we just received another question, and that is, what happens when a person has unrealistic expectations of the mentor? That's a good one.
And I
right?
think that's a very good question. And I think that's why you have the mentoring action plan. At the beginning of the relationship, you want that person to know that you are not the social worker, you are not the parent. You're there to help them with networking, you're there to help to inspire them, you're there to help them, to coach them. But you can't have unrealistic expectation that this person is going to open a doorway to your career. That is not the purpose of mentoring. So, it's very important coming into the relationship that you review your mentoring action plan and know what to expect from the mentor. It's a relationship. It's a guide. It's a coaching. It's not a social worker. It is not things that you're expecting from someone that is not realistic.
And I think that, as you mentioned in your presentation too, during that first face-to-face meeting would probably be an ideal time to go over what those expectations should look like.
Absolutely,
right?
absolutely.
Just define those roles and expectations.
Absolutely.
So everybody's on the same page.
Absolutely.
Okay. Are there any other questions from our audience before we wrap up? Okay, so while we wait, I'll go over and talk a little bit about our mentoring program here at St. Joseph's College. Our professional mentoring program started about 2 years ago by my colleagues. So we now offer it in both Brooklyn and Long Island. It's being offered in both Brooklyn and Long Island campuses. We connect our current students and alumni in career transition with mentors in their desired career field. The program is a great way to gain firsthand experience and knowledge and network with professionals in one's career field of interest. For our mentors, like Megan, it's a meaningful opportunity to share one's personal and professional journey and open the door for career awareness and advice for our aspiring students and alumni. If you'd like more information about this program, please visit the link currently on your screen. I also would like to mention that the next in our How To webinar series will feature another of our alumni, Betty Dugan with NYC Medical Reserve Corps, who on February 12th will discuss the art of communicating effectively and why it matters for career success. To receive login instructions, we urge all of you to pre-register for the event if you're interested. We always welcome any ideas for future webinar topics and feedback, so please feel free to contact me directly. My email is on the screen, and we will definitely take your suggestions into consideration. All of our alumni and guests are welcome to attend our annual Spring Reunion Weekend activities. This year's Reunion Weekend will take place from April 12th through the 15th. Our host of events cater to alumni of all ages and interests and include social opportunities to mingle and network. Tickets do sell out fast, so please register early. And finally, don't forget to connect with us on social media for updates on alumni events and news and other happenings at the college. I would like to, on behalf of the Office of Alumni Engagement, thank our speaker, Megan Haughton, for her insightful feedback, comments, and presentation.
Thank you.
And all of you out there for joining us today. And we'll see you next time. Thank you.
Thank you. Bye-bye.